Actually belong to me, or along with me, Taylor Swift. And in the studio, we have a special guest here. This is Timothy Sankury from the United States. Whereabouts in the States do you hail from?
Well, I was born in San Diego, but I went to medical school at UC San Francisco and got my master's in public health in epidemiology at UC Berkeley.
Now, can you just explain what is epidemiology for those of us that don't understand?
Well, if you've seen the movie Contagion, it's all about an epidemic, and epidemiologists are the doctors and scientists that specialize in epidemics.
Now, one of the biggest epidemics and one of the biggest problems we've had in our lives has been the arrival of AIDS, isn't it? And HIV. And you're a bit of a specialist with this, aren't you? Because you were there right from the beginning.
Well, that's true. When I finished medical school, I did my training at UCLA in family medicine, but I came back to San Francisco to look for my first job, and by chance it landed me in a clinic right in the middle of the city, and it happened to be full of AIDS patients, and nobody knew how to treat it or even there was no test and no medicine.
Did they know where it came from in the first place?
At that point, we did not even know where it came from or what they were dying of. But I had thousands of patients in the early days, back in 1983 and 4 and 5, and so it was very hard. The test did not come available until 1985.
And then there was like a lot of stuff on TV, warning you about this, and there was a big promotion about, you've got to be careful.
Well, I was part of that, but in the beginning, the panic was in the gay community. They thought at first it was a gay disease. Actually, it showed up first in the gay populations in the United States, and in drug addicts, and a strange little group down in Florida were Haitians from Haiti.
Really?
Mom and pop adults, male and female married couples were showing up with AIDS from Haiti.
Right.
And what the connection was of the same, how could this be drug addicts, gay people, and Haitians down in Florida? It was a mystery.
Yeah. So then what happened after that then? Because there was this big public awareness that's all of a sudden, and everybody went to, really, we got to wear condoms, we got to be careful.
Right. Well, because there was no test and there was no treatment, and people were actually dying of it. It was a very scary thing. In fact, the public health department in the early days, all they could do was count dead bodies, and I was losing all of my patients.
Wow.
Some very quickly, and my staff died. Other doctors, nurses, lab technicians, even my computer programmer died. I was very lucky.
But there was a turnaround, wasn't there? And they found treatments, not cures, but treatments.
Right. Well, starting probably in 1986, we started using the first effective medicine was AZT, but it had a lot of side effects, and we evolved from that beginning knowledge of what could work with the virus to probably in the 1990s. We had, in the very beginning of the 90s, we had a discovery that 3 drugs, a triple drug cocktail, could control the virus replication. Now we have hundreds of drugs, and treatment costs less than $100 a year and can effectively control the virus down to non-detectable levels. Look at Magic Johnson. He's been positive for 30 years and fathered 3 children since he got infected, and it is possible to even reduce it to non-detectable levels that may be almost non-transmissible. We don't know yet.
No.
Come on, get up, get out, and start grooving. Jingling around to the sound of music.
There's a lot of myths and misconceptions about AIDS and HIV, isn't there? Tell us about some of those.
That's true. Well, one of the biggest ones in some communities is the disease was spread by CIA operatives through Africa or some intentional government plot or something like that. And then the answer to that is it's totally impossible. The origins of the disease probably date back to 1920 when a monkey virus was entered into a human host. And that happens when, for example, example, a person preparing food cuts their hand and the monkey blood enters the cut, and that probably occurred in the 1920, according to some DNA mapping. But because the virus multiplies and spreads through sexual contact without giving any signs or symptoms for maybe 10 or 15 years, that silent spread allowed it to spread through Africa in a totally heterosexual way without there being any drug epidemic or homosexual activities. It's equally in men and women. So it spread that way and ended up having as much as 1/3 of the adult population in South Africa infected. Now, in West Africa, they have a high connection with Haiti, and that explains the Haitians being infected came through Haiti without them knowing it. So there's a high prevalence in Haiti as well. And then how did it get into the gay populations? Well, my patients explained to me that in the 70s and 80s, it was common to rent a jet and go on a junket tour down to Haiti, have sex with Haitians, and bring it back to the gay community.
Really?
So that's how the first airline stewardess was one of the first ones infected and passing it into the gay population. So it isn't strictly a gay disease, or you don't have to be homosexual or have anal sex to receive the infection. It's easily spread between men and women as well.
Well, there's also starting to be spread through junkies as well, with the needles and stuff like that.
That's right, and it's spread by needles. And interestingly enough, most of that occurred in New York as opposed to San Francisco, because they had the habit of shooting galleries where they would share the needles in New York City, sharing one needle among 20 people. In San Francisco, a little more affluent, they weren't sharing the needles, so the incidence was only 10%, or prevalence was 10%.
So now today, what's the chance of getting infected?
Actually,
by
there are about 34 million people with HIV today, and there's about 3 million new infections every year. So it's still a very big problem, because most people don't know they have it.
No.
And that's the biggest problem.
So, we have these medical checkups and stuff. Should it be part of an ordinary medical checkup?
Actually, most public health officials in the United States are recommending routine HIV testing as a matter of any medical checkup, or even at the dental office, So, and certainly any pregnant woman should be screened for HIV, because if by chance she is infected, giving the medicine in her pregnancy prevents it from going to her baby. So we save the lives of the baby by knowing. And that's what led to me writing the National Health Policy back in 2000 for the American Public Health Association, demanding that we develop rapid HIV tests that could be used in labor and delivery to test the mother who comes in and doesn't know if she has it, so we could quickly give her the medicine and save her baby's life.
Also, generally, it's like prevention is better than cure, and it's better if you know you have it and you can deal with it.
Absolutely. Now the medicine is so effective at reducing the virus down to non-detectable levels that early detection can prevent many of the, or if not all of the symptoms, so that people can lead a normal life, just like diabetics need their insulin every day.
Come on, get up, get out, and start grooving. Jumping around to the sound of music.
What's going to be the future?
Okay, well, there's a couple of things that people should be aware of. The medicine now, it's actually over 100 different medicines. With choosing 3, they can effectively control the virus, and the person with HIV can live a normal life, reducing the virus load in the blood to non-detectable levels. This happens after about 6 months.
But it still means you can infect someone else with it.
Well, this is what we don't know, because when the virus is non-detectable in the body fluids, the reservoir is in the DNA, for example, in the brain cells or the liver cells or the bone marrow cells, lymphoid cells, but as a reservoir inside the DNA, but the replicated virus floating around the blood is not detectable. So that may mean that a fully treated person may become non-infectious, and this may be the future of AIDS prevention.
Wow.
Because we don't have a cure. We can't eliminate the reservoir. We don't have a vaccine, or even very close to a vaccine. Some people say, well, the cup is half full and the cup is half empty. Well, as Tony Fauci of the NIH put it, we have a cup. That's all. We have a cup.
We don't know what it is, what level it's
We
at.
have nothing inside it. We only have the cup.
So it's down to testing then, and keeping testing.
Yes,
and the testing's become easier, isn't it?
Well, that's the point. Just after I wrote the policy in 2000, it was passed in 2001. By 2002, we had rapid HIV test kits, and they are an oral swab. Put it in the tube and watch it develop under your eyes, right in your hand.
So it's instant results.
Within 5 or 10 minutes, it develops just like a pregnancy test.
Right.
Now, these rapid HIV tests are now available since July, approved for FDA by the FDA for sale over the counter in the United States drugstores. They're sold for $40 around the country to anyone at any time.
Yeah.
So you can test yourself. You can test a partner.
For peace of mind.
Yes,
really.
absolutely.
Yeah.
So the combination of these two events, one, that we have effective medicine that's widely available and inexpensive, less than $100 a year, and two, we have rapid HIV testing that makes it easy and affordable and private and reliable. These tests are more accurate than the blood bank.
Wow.
So using these two together, we've created a new program to eliminate AIDS, and it's through the Rotary International, which has been responsible for ending polio. They call their program End Polio now. In fact, we probably will see the end of polio, if not this year, in the next couple years.
Wow.
So Rotary has done this over 35 years, giving 2 billion doses of vaccine, a polio vaccine, to end the polio epidemic. Now the next step after that, I'm hoping, and I'm suggesting to them, will be the End AIDS Now project, where we use rapid HIV testing in widely distributed through the population and help find the people that need the medicine, get them under control. They did this in a township in South Africa, where they went door to door, say ah, say ah, say ah. Oh, looks like you need the medicine. Come down to the clinic and we'll take care of you. They did that, and out of 5,000 people tested, 500 were positive and didn't know it. They got all into treatment, but it stopped the epidemic in that township by treating everybody that had the virus. That's the plan. I'm suggesting it's called the End AIDS Now project for Rotary International.
Fantastic. Well, I suppose the future is bright, but there's no need to be complacent at the moment, is there?
No, you really still need to protect yourself using condoms or testing your partners. There's still a small window of time right after a recent infection where the virus would not show in the antibody test that we do. So this is called the window, and it runs from 2 weeks to 2 months about in most people. So you still need to protect yourself with using condoms. Oral sex and even regular heterosexual sex is still a means of passing it. Some misconceptions we were talking about. A fellow told me last night he thought, well, it's only through anal sex. If you don't receive it in the rear, you're not going to get it. Well, that's not true.
No, absolutely.
Even oral sex can pass through the body fluids. So.
Now, just before you go, you got a story about Australia, because you've been quite sort of well known in Australia, haven't you?
Well, that's a long time ago.
Okay.
When
you
I was
introduced this to Australia or something? You introduced the testing? Or?
No. It was back in the mid-'80s where they invited me to be a guest on the Good Morning Australia show.
Okay.
And the funny thing was, I was supposed to be the first doctor to talk about AIDS on live television across Australia. And the first question they asked me, "Good day, Dr. Sankury, what's this new disease called AIDS?" AIDS.
AIDS.
And I froze because I didn't know, what is AIDS? AIDS. That's one I haven't heard about. I'm supposed to be an infectious disease expert.
Yeah.
And here I don't know about AIDS. Oh, you mean AIDS? Oh, okay. That's what I'm here to talk about. Oh, you could have seen me. It turned white as a sheet right there on national television. So
these things happen when you're on live television or live radio and stuff.
I
like
encourage everybody to support the End AIDS Now project.
Brilliantly. And also, don't forget, wear a condom.
Yes.
Thanks very much for coming in, Timothy Sankury. It's been a pleasure meeting you, and good luck with your program. Thank you
very much.